We've had 69 deaths, and we have 15 long-term care facilities in outbreak status. We did receive a truck from the state this week with protective equipment for all of our long-term care facilities, and emergency management is in the process of delivering those supplies. That's supposed to be a 14-day supply for them. We've seen an increase in testing over the last several weeks. The state did request that each county come up with a plan to test 5% of their population in 30 days. I will tell you that with the hospitals stepping up, we have tested 25% of that 5% in just 9 days. With that increased testing, we've also seen higher case counts almost every day. Today was our highest case count at 89 new cases. Because of the new cases that we're seeing coming in, we are increasing our capacity for contact tracing. At this point, we have additional school nurses that are helping in that area. But in addition, our internal audit staff are going to start working with us for a month or so, as well as some folks from Medic that will be helping with contact tracing as well. One of our specific concerns is that recently we've seen a fairly large uptick in the number of Hispanic cases. I mentioned that last week. We've now a third of all of our reported cases are among Hispanics. With the targeted testing, the essential jobs that they do that restrict their ability to social distance, we've also seen some household spread in large families, and their pre-existing disparities, especially in the area of poverty, all contribute to this. We are trying to address the situation with expanded outreach and education. We've developed a Spanish toolkit, which is on our website. We have pulled additional staff who work specifically with the Latino community to do targeted outreach. They're working with Hispanic-owned and serving businesses, as well as some other partners, including churches and the Latino Chamber of Commerce. We're also doing a good bit of work with media outlets. Radio spots will start later this week, and we've been doing quite a few interviews with their media. I do want to address one specific issue. Today, I used the term outbreak when it comes to our construction sites. In public health, we often use that term to refer to the spread of an illness within a group, place, or geography. My use of the term was in this general context. In the context of COVID-19, we've received specific guidance from CDC and North Carolina DHHS about defining and reporting COVID-19 outbreaks in long-term care facilities and other congregate living settings. No such definition has been established for other settings like businesses and construction sites. We are aware of some clusters of cases of COVID-19, likely linked to work site exposures among construction workers. And we are doing some significant work with construction sites to improve their ability to provide the appropriate PPE and to enforce social distancing in this population. We will release further details if there is a public health reason to do so. The other thing I wanted to mention are the trends that we're seeing. Our percent positives, although the number of cases has risen significantly, our percent positives have seen a slight decrease, which is the right direction we want to go in. Our hospitalizations have been stable. However, we are seeing a slight decrease in our social distancing, which is to be expected with some of the release of restrictions that we've seen in our community. That social distancing is still well above what it was when we first implemented our stay-at-home order. The other thing that I wanted to try to show you briefly is a new dashboard. We're going to try this and see if it works. We have worked with our partners at Emergency Management to create a dashboard. This dashboard will be updated daily at 5 p.m. We will continue to do the twice weekly data reports. Those reports allow us to frame the issues as they arise from data and put them in community context. So we will continue to do those reports as well. This dashboard will go live after it's being presented to you tonight. There will be a link from the county's COVID webpage for people to access this website. This dashboard. So what you will see on the dashboard on this first, you see at the top, we've got 4 different categories: community impact overview, social distancing status, medical facilities locator, and local businesses. At some point, we will probably be adding testing sites as well. Within this first page, you see our cumulative lab confirmed COVID-19 cases. And what I will show you, I hope, is that if you click up on the right-hand corner of that, it opens that page up for you, and you'll see the total number, but then you can go to the trend line at the bottom and open that up, and it will show you what we're seeing in terms of trends for this particular set of data. And then you close that back out. You can do the same in each of these other sites within the system. So this gives you an idea of our death trends, our hospital census of patients. You can see our trends, and as I mentioned, that's fairly stable. We've had a slight uptick in the last day or two. And the others, the last one I'll show you is the lab confirmed COVID-19 cases in the bottom left-hand corner. And what this shows you is the blue lines are the number of cases that we've had. The pink dotted line that goes up shows you, those are the cumulative cases, I'm sorry. The blue lines are those cases who have been released from isolation. So that gives you an idea of how many individuals have been ill and have been released from isolation. The social distancing status at the top just will keep you sort of informed as to where we are with social distancing. As I mentioned, we are seeing a slight downtick in the amount of social distancing, but again, it's well above where we were at the beginning. The map on the right shows you the lighter colors is the percent of devices staying at home. So the lighter colors are less than 20. That shows more activity. The greater than 60 shows you the percent of people on the road. So it just gives you a picture of what is happening. Under the local business tab, we have worked with local businesses. They have provided us with information about their open status or closed status, and they are asked to update this information regularly with us. So hopefully this will be useful to the community. And as I mentioned, this dashboard will go live after your meeting tonight, and hopefully will be useful to our community. And that's my report. Thank you.
Thank you, Gibbie. Mr. Chairman, at this time, I will turn the podium over to Sarah Cunningham, who will walk you through where we are with our CARES funding and proposals for the board to consider.
Thank you.
Good evening. Thank you, County Manager Diorio, and good evening, Chair Dunlap and Commissioners. Tonight, we'll be walking through the county's COVID-19 revenues and